Good morning, everyone, and welcome to the 2013 Early Learning Hub Technical Assistance Webinar. My name is Shane Sasnow, and with me here are Heidi McGowan and Megan Irwin, and I will be your facilitator for today. We appreciate you spending your time with us, and we hope you provide you with some useful information. Today's presentation is on the topic of collective impact, and it will be presented by Jeff Cohen, the Director of FSG, the Foundation Strategy Group. Jeff has more than 10 years of experience advising private and community foundations, nonprofit organizations, government agencies, and corporations on strategy, program design, and evaluation. And he spends much of his time working on U.S. education issues. So we are pleased to have him with us today. Thank you for being here, Jeff.
Sure, thanks. Happy to be here.
Before we get to our main presentation today, I would like to do a quick poll, and then I'll go through an overview of the agenda while you take the poll. So I'm going to open the poll now. If you don't see it, please type into the chat. You should see the poll, and you got about 3 minutes to finish this while I move forward with the slides. So the agenda for the day, we'll start with webinar logistics and then move into a quick overview of hubs, followed by our main presentation for the day. After the presentation, we'll have some question and answer time, review upcoming events, and provide contact information for our presenter and the materials that you'll see today. So quick starting with the webinar logistics. You'll note that your phone is muted. Please try to keep your phones muted as we have over 100 people signed up for this call, and noise will interfere with clear communication from our presenter, and we all want to be able to hear him well. You'll also notice that you do have a chat box on the right-hand side of your screen. It's available for you to send questions or comments to us throughout the webinar. We will monitor them as we go and share them with the presenter when appropriate and during the questions and answers at the end. A quick note, the scope of this webinar is to provide equitable technical assistance to all potential applicants on this topic. Questions related to the procurement process need to be submitted in writing to the Early Learning Division and will be answered in writing and posted online. And we'll give you information to contact Megan Irwin at the end of the webinar. We won't be discussing or answering questions related to the content of the RFA because it is a competitive process bound by procurement rules. In the first week of September, the Early Learning Division staff will be doing a series of in-person question and answer sessions regionally. Dates and times will be included in that RFA. For today, our focus and discussion will be about collective impact and how you might use it as a strategy in your early learning hubs. I'd like to remind everybody to please make sure that you are muted. So now I'd like to do a brief overview of early learning hubs. Since we're talking so much about them, it's good to know where this comes from. So starting with the vision. The reason that we are all here today, our vision is communities working together to improve outcomes for children. Some of the basic background information that has led to the development of this vision is the fact that 45,000 babies are born annually in Oregon, and this equates to almost 300,000 children under the age of 6 here in the state, nearly half of whom are born poor. 40% of these children arrive at kindergarten unprepared to begin public education, and by 3rd grade, 41% of Oregon's economically disadvantaged students are not reading at grade level, which leads to 32% of high school students not making graduation. This places Oregon in the bottom quartile nationally for receiving high school diplomas. In addition, Oregon has not had a coordinated statewide results-focused approach to early childhood education or school readiness, at least not yet. Over the last 2.5 years, much work has been done on the early learning education system, and from that work has emerged a vision for a cohesive early learning system where communities will collaborate, design their own strategies for delivering early childhood services, and ultimately share collective responsibility for the same outcomes across the state. I am closing the poll. Thank you for filling it in. Back to the slides. The Early Learning Council has specified 3 goals related to early childhood education. These goals are: first, children ready for kindergarten when they arrive. Second, children raised in stable and attached families. And third, services that are integrated and aligned into one early learning system focused on results. So with all this talk of early learning hubs, what exactly is an early learning hub? We've been defining an early learning hub as a self-organized, community-based, coordinating body created to provide a system approach to early childhood education that works to improve efficiency and outcomes for our youngest children. At a foundational level, early learning hubs will build on existing community resources and assets, ask tough questions about what can be done differently to get better results, especially for at-risk children. And it's important to note that communities have the option to define their own strategies and service areas to achieve outcomes. This diagram shows basic information about hubs. You see the child and families are in the center, surrounded by the community, which in turn are surrounded by the hub. The hub is tasked with finding the children for universal screening and then working with families to identify what they need and linking them with who will best address those needs. And finally, the hub is accountable for the outcomes it achieves. So this is a time of innovation and a new approach for early learning in Oregon. Under the community-based leadership of early learning hubs, Oregon will bring public schools, early learning providers, healthcare, social services, and the private sector together locally around shared outcomes for the first time in Oregon's history. Oregon is innovating in early learning. And with that, I would like to turn it over to Jeff Cohen for today's presentation. If you will bear with me for a moment, I'm going to switch to his slides and turn control over to him.
Great. Thanks so much, Shane. I'll wait a moment while we get the slides up.
Jeff, you should have control.
Okay.
Do you want me to back up on your slides? Oh, you have to do that. All right.
I can do that. That's fine. Great. Well, while I do that, let me wish everyone good morning, and thank you all for joining us this morning. I'm excited to be a part of this work that you're doing in Oregon, and excited to be at the conference in a couple of weeks as well. I hope that the ideas this morning will be helpful to you as you get started building these early learning hubs in your communities. In addition to the background that Shane provided, a little bit of collective impact specific background. So I am a director in the Seattle office in FSU's Education and Youth Practice. I've worked on collective impact projects on the ground, most recently in the Rio Grande Valley, working on a project to improve post-secondary attainment for students there. I've also done quite a few workshops on collective impact, including in Oregon recently, last October, one for the Fostering Hope Initiative in Salem. And I also do other strategic planning work beyond collective impact, but it seemed relevant to let you know that I've also been involved with this work on the ground. To talk about our agenda today, we have an hour and 15 minutes, and a little less now, but I'll present for about 45 minutes. I'll try to go a little bit more quickly to make sure that we have about a half an hour at the end to have Q&A and discussion, but I'll also be pausing for questions as I go through, so definitely feel free to, I think Shane will be moderating those, but feel free to send along any questions, and happy to answer them as we go through. We'll start with the key concepts of collective impact. We'll talk a bit about how to implement those concepts, and then we'll take a closer look at one example of a collective impact initiative to see how those work in action.
Jeff, do you have control?
I don't think I do, actually.
Hold on just one second. Let me redo it.
Sure.
All right, you should.
Okay. Yep. Great. All right. Sorry, I'm
Click on the slide.
still not able to.
That does it.
What's that?
Click on the slide with the mouse first and see if that gives you control.
Okay, sorry. I didn't realize the field was, okay, great, thank you. So just a bit about FSG before we jump in. FSG, we are ourselves a nonprofit. We're a consulting and research firm with a staff of about 110. We work not only in education, but across a wide range of issue areas. And as a nonprofit, one of the things we do is develop ideas like collective impact, where we observe what's going on in the field, try to codify it a bit and put it back out so that more people have access to it. So we do publish quite a bit in a wide range of publications, including Stanford Social Innovation Review and the Chronicle of Philanthropy. In terms of our role with collective impact, we work with it in a number of ways. We do client work where we help to implement collective impact initiatives on the ground, and in addition to the publications and webinars like this. There's lots of material for free related to collective impact on our related to collective impact on our website, and so I'd encourage you to go check that out after the webinar if you're interested in getting more detail. There's lots of articles and webinars and all kinds of things that should be helpful. So with that said, what we really are going to be talking about today is changing complex systems. And in the course of our work in collective impact, one of the systems that we've encountered is the juvenile justice system in New York State, which is charged with rehabilitating youths. In the course of our work with that system, we met one youth who had been in that system for 5 years, in facilities for 5 years, stemming from a first offense of shoplifting a pair of sneakers that cost $50. And so he went in the system, he was shipped off to a facility upstate, he was cut off from his family, he wasn't getting educational resources, ended up getting released, but back in the system over and over and over again. So, you know, one could ask how well that system was working. If you ask that question, you might say, well, what are the resources in that system? And the resources are actually, if you combine all the agencies that touch the youth, it's about $286,000 per year per youth. So this isn't a case, as we often see in the nonprofit sector or the public sector, where there isn't enough resources. What do they get for that amount of money? They were getting an 89% recidivism rate. So 9 out of 10 youths who were entering the system were going back in at some point after being released. So clearly this was a system that wasn't working as folks would hope it would be. And in this case, it is not a question of resources available. So then the question is, what's the issue? What's the problem? And I think we get a little bit more insight into that when we take a look at how the system's laid out. I'll let this fade in, but this is essentially the system. So you have hundreds of public and private agencies spanning courts, law enforcement, probation, county services, state agencies, 62 counties, and even that system, as fragmented as it is, must still coordinate with education, mental health, child welfare in order to serve the youth while they're in state care and then to transition them back into the communities. And so what you have is a lot of agencies, some of them well-resourced, all of them with the best of intentions, but there are so many agencies and organizations touching a youth and touching the issue that there's a lot of uncoordinated work going on, and so there's many opportunities for youth to fall through the cracks and to end up cycling back out and into the system. So I'm going to go from that example of a complex system that one would want to change to a discussion of kinds of problems. And so as we start to think about the motivation for a collective impact approach, we should look at what kinds of problems we face in the world. There are simple problems where there's essentially a recipe to doing something, and if you follow it, you get that outcome, baking a cake. You pull the ingredients together, you mix them in the right amount of time, you bake it for the right amount of time, you get a cake. There are complicated problems. Complicated problems are hard to figure out the first time. They require a lot of resources. They require expertise. They require experts. Once you figure it out, though, you have a pretty good chance of doing it again. So once it's hard to figure out how to get that first rocket to the moon. It's also it's not easy to do it again, but having done it once, you more or less know what you need to do. Then we also have complex problems. So raising a child, educating a child, every child is an individual, every child is different, every child is going to respond to an intervention in a different way. So you could take exactly the same action with 3 different children and have 3 different outcomes. And what happens there is that the individual context is very important, and there are outside factors that affect things, and so there's no guarantee of success, even if you have a pretty good idea of what has worked in the past. So we tend to treat social problems as simple or complicated, especially complicated, when I think many times they are complex problems that are extremely context dependent. So when we think about that, and I'll pause for questions right after this slide, the model has been that problems are complicated, and so the approach that has grown up in the social sector to address those complicated problems is that, you find a solution, you prove that solution, you prove that model, and then you either replicate it or scale it up, but that once the solution is found, you'll be able to either scale it or replicate it. And so this model, organizations work separately to develop an intervention. Evaluation attempts to isolate that particular organization or program's impact. Large-scale changes dependent on scaling or replication, and a lot of times the corporate and the government sectors are not necessarily involved. And so that leads to what we call isolated impact. You get good programs. You get impact at places where folks have developed programs and they're working, but you're not necessarily getting scale. So I'll pause for a little bit here to see if there are any questions before I take us into collective impact per se.
Thank you, Jeff. This is Shane, your facilitator again. I'm just checking in with folks. For those of you who joined a little late, please mute your phone if it's not muted, because we get some background noise. And to remind you that in the chat box is how we're taking questions. So if you have a question, go ahead and type it into the chat box, and that will come to us, and we'll share those with Jeff as they come through. At this point, Jeff, there aren't any questions yet. I expect we'll get a few.
Okay.
If you want to continue on.
Great.
Please.
Sure thing. So the challenge with isolated impact as we currently see it is that it doesn't work to solve complex social issues at scale. As I said, of course, there is good work that goes on. Individual lives are improved, even individual communities are improved, but it's not necessarily working at a regional level. And so the question is, why isn't it working why doesn't it work that well at a regional level? And there are, I think, a few elements to that answer. One is that contexts are different. Even within a region, they're different. Certainly within a state, Portland is going to be different from Pendleton. Rural areas are different from urban areas. Different areas have different populations with different assets and different challenges. And so, places and context is very important. I don't know how many of you read the Peter Buffett piece on Sunday, which was quite interesting and relevant to this. It was an op-ed in the New York Times where he, in addition to seemingly calling for the end of capitalism, which is sort of interesting, he points out the importance of context in philanthropy, and it's good, I think, to have a voice like that raising that issue, because I think that, historically our approach has been somewhat, if something works here, it'll work elsewhere, and that's definitely not the case. I think another answer is that you often have programs that are succeeding in part because of leadership. A Jeffrey Canada and Harlem Children's Zone, you're not going to have a Jeffrey Canada in every Promise neighborhood. And so, you don't necessarily get the same level of effectiveness because you're not, in that replicate and scale approach, you are not going to necessarily get that level of leadership. In collective impact, there's a way to deal with that. But, and then finally, even as you're developing that solution, you're piloting, you're replicating, you're scaling, things are continuing to change. And so the isolated impact model doesn't really have a mechanism for continuous learning and improvement. You really pilot that program, you figure out how it works, and then you go and you replicate and you scale it, but you're not necessarily getting new information into the system. And so, given all these challenges and given the fact that, we know that we're not getting impact at scale, a few years ago, FSG took a look at what was really working out there in the field and trying and coming across various organizations in various regions working in this way that we would call collective impact. We wrote an article to try to document it and to try to distill what those practices are. So I want to emphasize this is work that we already saw people doing out in the field that we just wanted to document so that others could see and try to implement some of those approaches. That said, what is collective impact? How is it different from other forms of collaboration? There's been, people have been collaborating for decades, for centuries really. What makes collaboration different from other types of collaboration, or collective impact different from other types of collaboration? I think one way it's different is that it is cross-sector. So public, private, and nonprofit sectors all have to be at the table. Another way it's different is that it's really inclusive. So it's meant to be everybody who touches on an issue being a part of the solution that gets developed in that place on that issue. 3 is that it's focused. It's not a general agreement to collaborate and to have meetings every once in a while. It's focused on a specific social problem and on making progress on a particular set of metrics that are tuned to that social challenge. And then finally, it's long-term. So it requires long-term commitments from the participants. So with that definition of, a long-term commitment by a group of important actors from different sectors to a common agenda for solving a specific social problem, we've isolated 5 key elements that emerged when we took a look at successful collective impact efforts. And these can all look different. This is not meant to be extremely directive. This is just elements that we have seen be in place for collective impact efforts that work, and they all take different forms in different places. But the first of these is a common agenda. So there's a fair amount of work getting this set of diverse stakeholders to a common understanding of the problem, to using similar definitions or the same definition for whatever the terms that you need are. I mean, when we worked with the juvenile justice system, there were 60 different definitions of recidivism. So part of the work is just getting people to a common understanding and common definitions, and then to a shared vision for what is the change that they want to make. And that is not to be underestimated, the amount of work to get folks to a shared vision. It can take anywhere from 3 to 6 months once a collective impact effort is up and running. From that common agenda, you develop a shared measurement approach, which is really a set of metrics that everybody agrees are the critical metrics. This is not 100 metrics. This is somewhere between 10 and 20 that everybody can agree are important for measuring the progress of the effort, and then putting in the infrastructure to collect data on those metrics, measure results, and share them, as well as think about what they mean and how they might be used to adjust and improve the initiative. A third piece, the third element of collective impact, is this idea of differentiated but mutually reinforcing activities. So all of the organizations, all the stakeholders are going to continue to be doing the work that they do every day. But the idea with the collective impact approach is to have somebody have some kind of coordination so that there may be some adaptations. If something isn't being covered, can somebody do that work? If there are multiple organizations doing overlapping work, how can we think about that so that that's somewhat less duplicative? So really having that common agenda and shared measurement, and using that to think about the activities that are going on and trying to coordinate them somewhat better to the community's needs. Fourth, we have continuous communication, and that goes both internally and externally. It's very important for these efforts that there's a lot of trust built, and so we do find that people have to have consistent and open communications. There have to be regular meetings. Senior leadership of community organizations has to be involved. But there also has to be communication to both to and from the community at large. So informing the community of how things are going, getting feedback from the community of how things are going. And so there's a number of different levels of communication. And that's one reason among a number of others of why these successful efforts generally require some kind of backbone support. It's a lot of work to do the data collection, to convene the meetings, to communicate internally and externally. And generally, the organizations that are already providing services out in the community don't have that capacity to do that. And so you generally see in these successful efforts some kind of dedicated capacity devoted to the collective impact effort itself. And I'll talk later on about what that can look like, and that can come in a variety of forms. But you do have some kind of dedicated capacity for those functions. And so this is a pretty, there's a lot on this slide, and so I definitely want to pause for questions here. There may be some questions about these 5 elements that we answer later, but there may be things that it's worth addressing now.
This is Shane, your facilitator. I'm still waiting on any questions. We want to make sure that the chat box is working. So if you have a question, please type it into the chat box, and it'll come through to us, and we can share it with Jeff. Also, a quick reminder for those of you who haven't muted your phones, please do so. No questions yet so far, Jeff. Folks were kind enough to write in and say that they don't have any questions yet. I think they're probably just absorbing all of the great information that you're sharing. Oh, there's one.
That sounds good.
Oh, yep, here they come. Okay, so the slides will be shared. We're going to have a recording of this, which will be online, which will share that information with you at the end. Another question.
Then you also divide it in
are you ready? So if I could just to remind one more time, folks, to make sure you mute your phones. So question for you, Jeff. Is our common agenda the 3 goals mentioned in the hub overview, or are the goals considered measurements?
The goals are not measurements, and I suspect that, given the structure of this initiative, the 3 goals would have a big influence on the common agenda, but there might be other elements, and each place might, there might be other things that are different across different places, depending on the particular challenges you face. But the measurements look different and are much more quantitative metrics that you can use to track, progress towards those overall goals. So if you are, to take an example from, education, one thing might be, what percentage of children who are, ready for kindergarten on, their, reading scores, who are entering kindergarten at a, level that they're ready. And the goal would be, of course, children ready for kindergarten, but then there would be metrics about probably different elements of readiness, academic elements, socio-emotional elements. So you can kind of break the goal down into particular metrics that you can then track, and so those are different.
Thank you, Jeff. I think we can move forward.
Okay, great. So we've seen this approach work across many different complex social issues, really any kind of, complex systems change work, whether it's community development, healthcare, homelessness, education, and certainly early childhood, and the early childhood education and care systems are very much have the characteristics that, we think are amenable to a collective impact approach, in that there are many stakeholders, it crosses a number of different systems, but it can be tackled on a place-based level in a particular region. But we have seen it work across many different kinds of issues. So then the question becomes, well, how does one get started with this? What needs to be in place? What needs to happen in order for an initiative to work? And what we found when we look at successful efforts, again, is we see at least 3 common things, preconditions, that are usually in place before launching an initiative. And one is an influential champion, or multiple champions. So somebody who can command respect and engage cross-sector leaders, somebody who's focused on solving the problem, but also understands that it's the community and the stakeholders who have to figure out the answers. And so clearly, the early childhood board is playing, the council is playing a role in that, and that's one champion. There may well be other champions that you would want to bring to the table in your communities, whether it's funders or leaders of critical organizations that are providing services. It's better if there are more champions, quite honestly. Secondly, financial resources. This is, obviously a big endeavor, and it requires committed long-term funding that can be used for infrastructure and planning, usually for at least 2 to 3 years to get the backbone up and running. And then finally, a sense of urgency for change. Often this comes in the form of an external jolt. There's a lawsuit, or there's some kind of legislation or some kind of policy change. It can also just be a community having a sense that something has to be different, that this problem's gone on for a long time, and something really needs to be done to change it. But it is extremely helpful for the stakeholders to have a sense that this is a critical problem. Existing approaches haven't worked. There are multiple actors who want change, and that there are funders and policymakers who also feel that way. So these are 3 critical preconditions. Once those preconditions are in place, and someone has decided to try to start getting a collective impact effort going, we have seen a general arc of development that looks like what I'm about to talk about. And bear in mind that these phases that I'll go through can take, there's very different time depending on the community. So there's a phase 1 where folks are initiating action. On the governance and infrastructure front, you're developing the initial group structure. You're putting in place some communication and decision-making processes. On the strategic planning side of things, you're mapping the landscape, and you're getting the initial sense of the data snapshot. What's currently going on? Where are we on this issue? On the community involvement front, you're starting to do some community outreach and get people aware that this is going to be happening. And then finally, on the evaluation and improvement side, as you collect that baseline data, you're using it to actively identify the key issues and gaps that the initiative may want to focus on. Once you've done all those things, there's a phase 2, which is really the phase where the backbone is being set up. So with governance and infrastructure, you're setting up the infrastructure and the backbone, figuring out what organization is going to be doing that work, getting it staffed up. On the strategic planning side, you're creating that common agenda as a group. With community involvement, you're continuing to engage the community. You're starting to build public will to make this work. And then on the evaluation front, you're establishing the shared metrics and indicators, and starting to think about the measurement approach and who will be doing that. And then once that's really the hard work of setting the initiative up. And once that's done,
Jeff, click on yours real quick.
Okay. There we go. Once that's done, you're into a phase of sustaining action and impact. So it's really facilitating and refining the governing structures and making sure the backbone it has the right capacities to do the work, supporting the organizations that are out doing the work and making sure there's coordination and alignment to the goals and strategies, continuing community engagement, starting to perhaps conduct some advocacy. A lot of times there are policy issues that are identified in the course of doing this work that the backbone and the community can then go speak with their legislators about. And then finally, it's very important to continue to collect and track data and to report progress. So a lot of these initiatives report out every year on the baseline metrics. So what have we made progress on this year? Where haven't we seen progress? What does that mean for how we're going to move forward? This slide is a little bit complicated, but the idea is to give a bit of a stylized structure for what a collective impact effort works like. But I do want to pause after that, the preconditions and the 3 phases slide, and see if there are any quick questions before I get into the actual structure of an effort.
Yeah, we did have a question a little bit from before. said, one of the problems I have noticed in collective impact work is that partner organizations are still dependent upon securing their own funding and hence their own individual identity. This makes collaboration more difficult. How can costs be shared and funding sources shared to build more collaboration?
It's a great question, and it is a challenge because collective impact doesn't, of course, displace and isn't meant to displace all the individual organizations that are doing work and that still need to, you know, show impact and get funding. It's so there is, I think it's not a tension that ever gets entirely resolved. The hope is that by coordinating better and honestly by having a common strategy, a common agenda, that more funding can be brought in, and we've seen that work. It doesn't, you know, even if more funding isn't brought in, the hope is that at least across the entire community, the resources are being used in a more efficient way. But I think that part of the answer is also just the process of collaboration, the process of getting people to talk to each other more and trust each other more, I think does slowly erode that sense of competition for resources, but it isn't an easy process and it isn't an easy answer. So, you know, I think that what's really great is if an effort like this does help to attract more resources into the community to do this work. But I think even assuming that the level of resources stays the same over time, one hopes that there gets to be a bit of more conversation, collaboration, and coordination. I don't know that that's the most satisfying answer, but that's really, it seems to be how it plays out.
Okay, Jeff, great. We have another question. Can the urgency for change be due to the alignment of critical positive conditions rather than negative or problems occurring? An example is when a community conducts asset mapping and an opportunity for large-scale system change presents itself due to the other two conditions being present, the champion and resources.
Absolutely. Yeah, right. I think that's actually a great way to create urgency for change, that, you know, there's been a policy shift that's favorable, you know, there's funding available, there's a, you know, a window of, you know, action where, you know, one example is a Race to the Top grant where, you know, people got galvanized because there was funding available. So certainly doesn't always have to be a negative cause for that sense of urgency.
Thank you. We have a question about timing. About how much time would each phase require?
It will vary depending on where communities are starting from. You know, for the initiate action phase, I think that is somewhere between 3 and 6 months. Organizing for impact, and again, I don't want to just say everybody, you know, will take the same amount of time, because I think each situation is different. And but usually what we've seen is that if there isn't a backbone organization chosen, if there's no backbone in place and no obvious backbone, it usually takes 12 to 18 months to get through phase 2. If there is a backbone, that's a different story. And then finally, sustaining action and impact, there is no time limit. It starts when you finish phase 2, and it just goes on as long as it makes sense to be working on this issue. And so there are now efforts that are in their, you know, 7th, 8th, 10th year.
Thank you,
but
Jeff.
the idea is that, yeah.
Oh,
go ahead, Shane, sorry.
When you're done, we can move forward.
Okay, great. So I will spend a bit of time on this structure slide, and then we'll see what I hope is a helpful concrete example in the case study at the end. What you have here are the main elements of the structure of an effort, and I'll start with the backbone on the far left, which is really the coordinating body. It's doing a lot of the work of coordination and communication and data collection, and, you know, if appropriate, advocacy. You see that above the backbone there is a steering committee, and that steering committee is composed of members from the organizations the stakeholder organizations and from the community. So that's why there are little colored boxes that represent partners and community members, because ultimately the backbone is responsible and accountable to the community, and the community is represented in the steering committee. So that's really, the steering committee and the backbone are charged with governance and stewarding the vision and strategy of the effort. In terms of actually getting work done and putting initiatives into place in the organizations and making changes, you have what we call working groups. And generally the way these fall out is that within a collective impact effort you have 3 or 4 strategies. The example I use a lot is the Rio Grande Valley work that I was most recently involved in, where you have the overall goal is to increase post-secondary attainment, but you have a working group focused really mainly on what's happening in the K-12 system. You have a working group focused on the transition from K-12 to post-secondary, and then you have a working group on post-secondary. And so the composition of those working groups depends on who wants to get involved and who's working in those particular areas, but those are the folks who are really coming up with translating the goals into particular initiatives at the level of what are these organizations going to be doing differently? What are the metrics they're going to be trying to move? If we want to reduce the 9th grade dropout rate, what is the K-12 working group going to suggest to do that? Then you've got the implementation, so all the partner organizations are doing that. So the working groups are kind of coming up with the strategies and the recommendations, and then organizations that are doing the work are thinking about, okay, well, what does this mean for our work? Do we have to change anything? Do we have to coordinate more? Are there, do we have to shift a bit? Or do we just have to do more of what we're already doing, or just keep doing what we're already doing? And then finally, you have the community at large, which, again, is providing feedback on how things are going, is kind of the audience for the data and for the metrics, and can really help in building the public will, both to keep the initiative going at the community level, but also if there are policy changes needed, if there are things that need to happen at the local or state level, the community can mobilize to make sure that those things happen. So complicated slide, but helpful in laying out what the different layers of the structure are. And it takes time to get all of this up and running, as you might imagine. But once it's running, it can be very, very powerful. I want to talk a little bit more, given that we're interested in early learning hubs, about what a backbone organization does within that structure, and what's required of backbone organizations and what they can look like. So one key function is guiding the vision and strategy. Helping to make sure that common agenda had been developed, continues to evolve. Another key role is facilitation and coordination. So just looking over what everybody's doing and making sure that folks are being convened and talking to each other, providing technical assistance as the case may be, bringing in new partners, and then making connections across different efforts and connecting people with each other where they seem to be doing things that where they might benefit from that. Another key function of the backbone is the data management function. So collecting and analyzing, interpreting and reporting on the data, helping to support that shared measurement system, and also providing technical assistance for the data capacity for partners out in the community. A fourth role is building public will, essentially community outreach, making sure the community knows what's going on, making sure the community is giving feedback and that feedback is heard, supporting activities to help that happen, and then really just that communications function in general. Not every backbone will do this fifth thing, but a backbone can, based on what it's seeing and on what the community and the stakeholders want, can advocate for a policy agenda. And then finally, the backbone can be very helpful in getting additional public and private funding. And a good example of that is the Roadmap project in South Seattle and South King County, where the backbone helped organize a Race to the Top application that brought $40 million of federal money into the region for that effort. And I want to be clear, the backbone is not raising money primarily for itself, although the backbone does have to be self-sustaining at some point, but mainly for instance, that roadmap example, all of that money went to the partner agencies. It went to the folks who were doing work out in the field and on the ground, and it did not go to support the backbone. So given all that, it's a pretty intense agenda for an organization. What does it take to be successful at that work? What we've seen is that backbones have to have a high level of credibility within the community. It doesn't work very often for an outside organization without connections, without relationships, without trust in the community to come in and try to do this work. Somebody at least has to have some visibility and credibility. The backbone has to be seen at least as reasonably neutral because of the work it will be doing as a convener. It can't be seen as highly aligned with one particular approach or one particular, organization. There generally, in order to do all this work, has to be some dedicated staff resources. The backbone has to be good at building relationships. It also has to be pretty good at keeping that sense of urgency, making sure people stay focused. The backbone should be thinking about evaluation not just as a way to have accountability, although that's important, but really primarily as a tool for learning, because one of the big advantages of collective impact is the idea that you're learning and you're feeding that learning back into the agenda, so it's adaptive. So as things change, the initiative can adapt to those changed conditions rather than just be, this is a set of solutions we set up 5 years ago and we're going to keep doing them even though things have changed. We've made progress on some issues, other new issues have arisen. The idea is using evaluation to collect information about the environment and use that to modify strategy as you go along. And then finally, the backbone is generally behind the scenes. And so the idea is that there's collective ownership of this. And so the backbone has to be pretty egoless in letting the collective take ownership and credit for what's happening out in the community. So I will pause again there, realizing that's a lot of information on not very many slides, and see if there are any questions about.
We have 10 minutes until 11 o'clock, and then we'd like to have 15 minutes on questions, and we're keeping track of the questions here. So if you would continue
keep going
to the presentation, and then we'll do a question and answer period.
That sounds good. Great.
Thank you.
I'll try to speed up a little bit. A lot of times we get the question of does a backbone have to be a particular kind of organization, a particular structure? The answer is no. We've seen successful backbones of many different types: new nonprofit, existing nonprofit, government agency, all kinds of structures that we've seen. This work does require, in addition to these technical things that we're talking about, some more subjective mindset shifts. And one is a shift from technical problem solving to adaptive problem solving, allowing answers to emerge from the community, thinking more about coordinating and aligning activities that people are doing rather than saying this is the solution we're going to put in place, everybody has to go implement it. It's more of a collaborative process that allows you to deal with things as they emerge. Another is the shift from silver bullets, this is what's going to solve the problem, let's do this one thing, to the idea that if we have a coordinated effort like collective impact, everybody will be doing their work, making small changes, and that those small changes and improvements, as they're implemented in alignment with each other and shared with each other, can add up to large-scale progress. And then finally, and this goes to one of the questions we had earlier, shifting the mindset from credit to credibility. Creating new incentives to work collaboratively, so it's not just about who is responsible for this positive change in terms of the organization, which organization is going to get credit for it. That's never going to go away entirely, but it is about shifting more to how do we as a community think about, are we making progress as a whole? None of that is easy, but it's important to call out up front. Again, some further intangible elements that make this work. Really building trust, and that's what the communication and the convening is all about, getting people to talk to each other and trust each other and collaborate more. Identifying leadership in organizations in the community, and Collective Impacts offers a lot of forums for leadership development for folks who are 2 or 3 or 4 levels down in an organization. creating a culture of learning, not just accountability, so that you can modify strategy as you go. Building connections in the community between people at all levels. And then finally, I think what we've seen a lot is that an effort like this can really give people hope that something will change and that this is a different way of going about things. I will quickly go through a case study because I know this is a lot of abstraction, and I think it's helpful to see a concrete example, and then we'll hopefully have a little bit more than 15 minutes for questions and discussion. So there's a collective impact effort focused on youth substance abuse in Franklin County, Massachusetts, which is a rural area in western Massachusetts, and the effort is called the Communities That Care Coalition, and it emerged from a sense of urgency that the folks in the community saw a steady rise in substance abuse rates for youth in the county, where you had 65% of 12th graders abusing alcohol, 40% abusing marijuana, and 23% abusing tobacco. And so people got together and said, okay, we have to do something about this. And I think, recognize this, similar in some ways to what's going on in early childhood approaches. It was a two-pronged approach to identify the risk factors and decrease those, but also to identify the protective factors and increase those. So to use the evidence and the research out there to identify those factors and then figure out how could this effort make behavior change in the community to reduce substance abuse. As you can see on the right, there are a lot of folks who were involved in this effort. You had the DA's office, police departments, youth serving agencies, the school districts, local businesses, the media, faith-based organizations. All these folks got together to agree on a plan. This is an example of that complicated slide, what this structure can look like in practice. You have the community. In this effort, you actually had two backbones, two organizations that were serving as the backbone. There was a coordinating council that served as that steering committee, and then you had three different work groups, one on community, so those are the three different strategies, the working groups, one on community norms, one on parent education, and one on youth recognition. And then finally, you had, a task force that was mediating between all this and the local schools. There's a little bit more detail on what the work groups were doing. When you have the slides, you can look at this. I won't go into it, but the idea is that everybody's got their own things that they are working on as a work group. The way that this effort used data, they used it in three ways. One was to assess community needs. Another was to continuously monitor teen health and usage. And then a third was to evaluate the collective impact effort in an ongoing way, both in terms of the process and in terms of the overall outcomes and impact. And so essentially, just to give you an example of something they came up with, one of the risk factors was poor family management. So they found that youth who have regular family dinners are at lower risk for substance use. So the coalition decided to try to change social norms around that through media to try to encourage families and youth to have dinner, with the family. And so they did succeed through a media campaign in driving that rate up by 7 percentage points. And in fact, they found that had an impact on attitudes towards on other risk factors. So it changed parental attitudes that there were never that many parents who were favorable to substance abuse, but it drove it down from 19% to 12%. So what results does something like this have? One is that it's brought in more funding. So having a coordinated effort like this has helped to bring in funding from the state. And it's also had direct impacts on substance abuse. So alcohol use is down 29%, cigarette use is down 41%, binge drinking down 37%. So there has been a clear, over the last 10 years, reduction across all of these categories. This is really a slide, the last slide is just a little bit of a summary, little cheat sheet for collective impact. And then there's some questions there that we can talk about, or if you have other questions, we don't have to. And then finally, at the end is my contact information, which Shane and Heidi will share with you. But I'll leave it on the questions page. But let's jump into the discussion and Q&A.
Great, Jeff. We definitely have some questions for you here.
Great.
Start off with one about backbones. The
Yeah.
question is, how do the individual hub backbones and the state backbone work together on shared measurement practices and other overlapping roles?
That is a great question, and I think it depends on, I mean, I don't know enough about the details of the effort. What I imagine, what we've often seen, where you have a set of regional backbones and then kind of a statewide backbone, is that the statewide backbone can set an overall general agenda, which is then in a way customized by the individual local collective impact initiatives. The state level backbone can help think about metrics and can suggest metrics that might work and can make resources available in terms of data. We think it's important for each community to develop its own set of metrics, but there may be state or government requirements as well. And so there's probably, I don't know where that middle ground lies. I imagine with each effort it's different, but there should be scope both for, you know, an overall guidance from the state level effort, but for, you know, local customization. And then finally, we've seen state level backbones be very good about providing technical assistance and support to the local efforts, and also seeing what's going on across multiple local efforts and connecting local efforts that might have things in common or that might benefit from being in touch with each other. So kind of a backbone for backbones in a way. But, you know, yeah, sorry, go ahead, Shane.
Well, we have Megan Irwin here, the Early Learning Systems Design Manager, and she has something that she can contribute to this question.
Great.
Thanks, Jeff. This is Megan. I just want to affirm to the folks on the phone that what Jeff articulated about having the state function as a backbone for the backbones is the exact direction that we're thinking in. So we'll look at a set of metrics for each hub that are shared across the board and some common ways of collecting the data on those metrics and using it in a shared way to understand what's happening in our early learning hubs. But the primary function of the state team, once we get through the RFA and actually the contracts that are awarded, is to build out a learning collaborative so that we can provide support to the local backbone organizations and build out ways to make good ideas travel faster. And when local hubs are bumping up against barriers, have ways of troubleshooting those barriers rapidly so that you don't suffer under a lot of limitations to what you're trying to do locally. So we are looking at models for how to build out a backbone for the backbone organizations as the state function.
Jeff, did you have anything else you wanted to add?
No, I think that's great.
Great. Okay, so I'm going to go to another question. Let's see, we got a couple here. When the process in a community is not effectively engaging the community or building necessary levels of trust, what are effective interventions?
Yeah, I think the first thing is to diagnose why that's happening, and there could be a number of underlying causes. You know, one is that there hasn't been much collaboration, and it's identifying who are the key people that need to be at the table who haven't been engaged. You know, a more difficult circumstance is where there has been interaction, it hasn't been positive. You know, if there's mistrust and there's, other things that, have to, competition and other things that have to be overcome. Again, I think it's the same solution, it just takes longer and it's harder to get the right people, figure out, who are the key people, get them to the table. Is there a multi-stage effort where you have a certain group involved at first and then you sequence bringing people in. I mean, it gets into the real details of implementation, but I think, there are ways to deal with it, but I think it's important to diagnose what is the cause for, the lack of community engagement up to now, and then go from there in terms of how to deal with it.
Here's a related question. How do you quantify trust?
Well, you don't. You know, I think there are byproducts of trust, though, that you can observe. And so, you know, in terms of process metrics, there are, you know, one thing we do is just, you know, who shows up at the meetings and how consistently do they come, and how, you know, because that's a sense of, you know, are people getting value from the meetings, which I think is a byproduct of trust. Another thing, though, is to see, are there collaborations that are happening that are not directly, you know, not everybody in the room, it's not the full collective impact initiative, it's not all the stakeholders, but it's people making connections and saying, hey, we're both working on this, why don't we try to, you know, figure this out? And so what we see when this is working well and there is trust being built is that people will connect with each other and start to do things on their own, which is really part of the idea. You know, you want innovation to be going on. You want to create a context where people can not just do what the official, you know, collective impact effort is doing, but it's really to create an environment in which collaboration and innovation will happen. So I think that it is hard to quantify exactly, but I think you start to see things that you know or due to that. And another piece is, you know, when people are talking about, well, what could change policy-wise? You know, what do we need to do? They start talking about, you know, we want to move forward, but, you know, there are X, Y, and Z, you know, things that we need to get changed. So I don't know that you can quantify it. I think you can come up with certain metrics to measure things that are byproducts of it.
Great. Thank you, Jeff. Real quick, we have a question that Megan Irwin would like to answer. And the question is, where does the state expect that local hubs are in the 3 phases at the time of application?
Hi, this is Megan again. So giving a really concrete answer to a question about state expectations gets us a little bit into the scope of the RFA, which we need to stay away from because of rules around a competitive procurement. But what I can say is that our hope is that today's content, combined with our upcoming webinars on asset mapping in your community and aligning for collective action, which really looks at using data to figure out what challenge you want to take on in your community, combined with the summit that we're having on August 12th, where Jeff will actually be with us in person, so you'll have the chance to engage with him in person with some of your questions. We're hoping that the combination of all of the information that we're providing in this way gives communities a starting point to figure out where they're at and a foundation for initiating action. It's hard to give a more concrete answer than that. We know communities across the state are in all different places, and we can't really get into specific state expectations without getting into what's in the RFA, which is off limits while we're in a procurement process.
Great. Thank you, Megan. Jeff, another question for you. This is actually 3 questions all in one, but we can take them all together or one at a time. You can stop me if there's too many at once.
Sure.
Could you address examples you have seen of effective methods of selecting the backbone?
Mm-hmm.
What is the process of deciding that one organization will be a better backbone than another?
Yeah.
And how are differences of opinion resolved regarding the selection of a backbone? So, could you address examples you have seen of effective methods of selecting the backbone?
Sure. I think I think last year when we were doing this work in the Rio Grande Valley, there was an excellent selection process in place there. I'd say there are a couple of principles that need to be in place. One is that there needs to be clarity about what the criteria are, because obviously if there are different organizations competing, everybody wants to know what the decision criteria will be. And I think there also has to be transparency in how those are applied. And I think also inclusion in the decision-making process. I think it really has to be seen as a decision of the collective and not of a few influential voices. And so with the work in the Rio Grande Valley, there was actually an RFP for the backbone released where, you know, the criteria were laid out. It was, you know, made available to everybody who, you know, was openly available, the RFP. It wasn't just sent to a few organizations, so anybody could apply. And, you know, basically, so folks did apply, and the steering committee made the decision but there was input from the larger community, and also there was constant communication about how that process was proceeding. So I think that it is important to think really carefully about the process and make sure that, you know, the clarity, transparency, and inclusion are all addressed. And I think in terms of differences of opinion, if there are differences of opinion about who should be the backbone, at least in that way, they're addressed in an open. I mean, obviously there are elements where that are kept confidential in terms of the exact point. I mean, again, sort of getting into the details of implementation, but I think there are certain principles, and then there are processes that can be used effectively to choose a backbone that generally I think look a lot like an RFP.
Thank you, Jeff. So there's a quick question about how to access FSG and their expertise, and I just want to let everybody know that Jeff will actually be at the summit, so you will have an opportunity to talk to him directly about that. Another question is, what is the intention and plan for integration between the early learning hubs and the CCOs? And Megan Irwin actually has an answer for that one.
Hi guys, Megan again. So for anybody on the call that isn't familiar with the acronym, CCO stands for Coordinated Care Organization, which are the organizations that have now come together to coordinate healthcare locally in Oregon. House Bill 2013, which is the statute that created the final framework for early learning hubs, calls out coordination between early learning hubs and healthcare, and specifically CCOs, really concretely. So the degree of involvement of a coordinated care organization in the early learning hub is up to the community locally and really is up to what makes sense. But as you're having conversations about how to get organized, it's important that your local CCO and other healthcare providers like County Health are involved in the conversation, as healthcare is called out specifically as one of 5 sectors that need to coordinate on the application.
Great, thank you, Megan. So at this point, that's about it for questions. If any folks have any more questions, feel free to put them in the chat box. Otherwise.
Great. Well, my contact information is there, and also I encourage folks, if you have questions, feel after this is over and before the summit, or if you won't be at the summit, feel free to shoot them my way. I'm happy to answer them, and hopefully I will get to meet many of you in person at the summit.
Thank you, Jeff, for your presentation today, and thank everyone for participating with our webinar and taking your time to join us. So we have some information for you here at the end of the slides. It is information on upcoming technical assistance events. We have another webinar on July 31st, Community Readiness, with myself, Shane Sasnow, and Heidi McGowan. And on August 7th, Creating a Shared View for Coordinated Action with Anne Murray Allen. And of course, the summit is on August 12th, and we hope that you will all be able to join us. And that is at the Salem Convention Center from 8 to 4:30. And please register for each of these events online when you get a chance. Last, here is Jeff's contact information again. Also, the contact information for Megan Irwin, the Early Learning System Design Manager. You can contact with her with questions that you have. And lastly, if you're looking for the materials, this whole webinar will be recorded, or has been recorded, and along with other materials will be at OregonEarlyLearning.com. If you go to the drop-down menu at Major Initiatives, then go to Early Learning Hubs, and then Technical Assistance, that is the page where the information will be. I didn't give you a link because the link is far too long to list here and for you to copy down. We will leave this up for a few moments so that you can copy down any information that you would like. I'd like to just thank Jeff Cohen one more time. Thank you, Jeff, for your time today. Really appreciate your presentation.
Absolutely. Thank you, Shane and Heidi and Megan, and happy to be here.
And with that, thank you all for your time, and we look forward to seeing you at the summit and perhaps at the next webinar. Have a great day.